So it's my great pleasure to introduce Piper Grant to you today as your speaker.
I'm so excited to be here today. I have sat in this room and watched many speakers come through here, and I feel like I've always left with something. I've always been inspired. I have met people both personally and professionally here that I carry with me through my life. And so I had actually wanted to start by kind of going around and having everybody introduce themselves, but when I'm looking at the time, I'm going to just kind of get straight into everything. But I was happy to see you guys like mingling over here and meeting each other, and I hope to see some of that over here because, like I said, it's a great opportunity to meet other people in the field. It's a great opportunity to expand ourselves and make some friends too. So I have not used this little clicker thing, but I'm going to try. As I go through this presentation, please feel free to ask me any questions. We do only have an hour left, so we'll try and kind of like get through things and make some space for questions. But just know that feel free to raise your hand and ask me a question. If I can't answer it, I will try, but if I can't answer it, maybe somebody else in the room can answer it. So let's talk about why this is worth your time to kind of sit here and listen to this. Why is it worth my time to be here and tell you about this? Why am I excited about this topic? The reason is that I feel like sexual fantasy isn't often talked about. And I do work in the field of sex therapy, and so I kind of bring it up a little bit more organically than if somebody was in practice working with somebody on, let's just say, anxiety or depression. It might not come up as organically. But what happens whenever I bring up the topic of sexual fantasy, I usually get the first response of, no one has ever asked me this question before, or something along the lines of, I have never told this to anybody. Because I'm not asking about sexual preference. I'm not asking about what do you like in the bedroom, what do you like to do. I'm asking about where does your mind go when maybe you're masturbating or sitting there thinking about sex, or with your partner trying to reach orgasm or trying to heighten your arousal. Where does your mind go? And often people don't talk about this. And the reason of that is because there can be a lot of judgment around it, there can be a lot of confusion for people, there can be a lot of shame. I think sexual fantasy offers us incredible insight, though, into underlying sexual scripts, and not just underlying sexual scripts. I think it offers insight into different parts of our clients' minds and different workings. And as a clinician, I'm kind of always just looking for new inroads into clients, you know? And so if it's one question that kind of sparks something that's going to deepen our work or add to our work, why not go there? People are embarrassed about it. They're worried about their sexual fantasies. When you start talking to clients about their sexual fantasies, often they'll start coming up with wondering questions about, like, is that normal? Why do I fantasize about this? It goes against maybe everything that I think in my normal life. So for instance, you might have a woman who stands against domestic violence against women, you know, and she's really a pro-feminist. And then in her fantasy, she fantasizes about men taking advantage of her and ravishing her body. How confusing is that? If in your life you're really sitting there and you think, I stand against violence against women, and yet somehow I get so sexually aroused at the thought of men taking advantage of me. It really leads to a lot of confusion for people. And I think in our work as clinicians with clients around sexual fantasy, we're able to alleviate that shame, we're able to alleviate that confusion, and it actually allows them to experience sexual arousal more fully and more intimately with themselves or with partners. So let's talk really quickly. If I'm moving really fast, you guys let me know, but I want to make sure we get through everything. So let's talk about kind of where I'm going to be heading today. Can you see? Okay. I'm going to be kind of going through first a little bit of some psychoeducation about sexual fantasies, just some information about sexual fantasies, and then we'll transition into how might you as a clinician bring sexual fantasies into the office. How can you understand them? What do you do with them? There's a seat right here, Douglas, too.
There's no seat up here, okay.
Yeah, just in case you need one. And then the last but not least, whenever I've talked about this, I give this presentation talking about sexual fantasies that exist up in our mind. But towards the end, people always ask, well, what if clients want to start enacting sexual fantasies? What if they want to play with sexual fantasies? So I'm going to touch on that at the end as well. The taboo of sexual fantasies. Kind of going back to what I was saying about in the beginning, people don't want to talk about it. And it's, again, because I'm not asking about the sexual preference. I am asking about what are those deep, deep things that you are fantasizing about that you don't even want to share with your partner. So many couples have never shared their sexual fantasies, by the way. I mean, because it's a very vulnerable process. It's when you are sharing your sexual fantasies, you are possibly opening yourself up to judgment, to people shaming you. You know, gosh, how can you be somebody that fantasizes about being raped? Do you know how wrong that is to be raped? Like, why would you get turned on by that? And how shameful is that? So really, when you're opening yourself up and sharing your sexual fantasy, both to your clinician, partner, friends, whatever, I mean, people don't sit around over lunch and like, hey, you know what I fantasize about when I masturbate or when I'm trying to, you know, like be with my husband or my boyfriend, whomever. I think 50 Shades of Grey, and granted I have not seen the movie, okay, and so, but I'm just gonna say, I think it did open a little bit of the discussion about sexual fantasy, but then that's going into the kink BDSM and that's enacting it. But I think it did open up something about being able to talk about kind of those deeper desires, maybe, or fantasies that we have. I want to start with what is a sexual fantasy. This might seem pretty basic, but I've even had clients ask me, like, is that a sexual fantasy or what is that? So I just want to start with the basics. I'm going to start with a quote. It's any mental imagery that is sexually arousing or erotic. A sexual fantasy is really anything from like a minute 15-second, 10-second kind of spurt imagery to a well thought out narrative. Often people have a well thought out narrative, and it's kind of, there's probably usually a core theme. It can change over time, but maybe if there's core themes about, I'm just going to go with like being praised or having their body praised, their fantasies probably have those core themes, and it just changes kind of as a lifetime goes on. But you'll often find that there's some common themes. It can be completely realistic or unrealistic. You could be fantasizing about having sex with multiple people on top of a cloud, which we know is unrealistic, to just having sex with somebody on your couch. I mean, there's such a range. But really what a sexual fantasy is, it is an opportunity for your mind to escape reality. And it gives your body, and I'm going to go into the function of a sexual fantasy more so with this, but it really is an escape from reality to create psychological safety so that one can experience sexual arousal. It's free of judgment, shame, guilt, and responsibility. I'm going to keep talking about that because that's why we actually have sexual fantasies, because it allows us to escape all of these things in our real life that judge us, that shame us, and that then lead to sexual inhibition. A sexual fantasy can either stimulate arousal or it can be stimulated by arousal. One person could be sitting on I don't know why I keep going back to a couch, but a person could be sitting on, I don't know where it's going in my imagery right now, but a person could be sitting on their couch, have a sexual fantasy, find themselves turned on, and want to masturbate. Somebody could wake up in the morning, want to masturbate, and then go into a sexual fantasy to heighten their arousal. Sexual fantasies can happen inside sexual activity or outside sexual activity. It can happen in relationship with other people. I mean, many people escape into a sexual fantasy while they're in a sexual act with somebody else or multiple partners, or it can happen by yourself. It can happen anytime, anywhere, basically, and it can have different kind of purposes. It can evoke it or it cannot evoke sexual arousal. I want to really make a distinction between sexual fantasy and sexual preference, and I'll probably keep going back to this throughout. A sexual fantasy is not necessarily a sexual preference. And the reason I want to emphasize this so much is, especially as clinicians, when we have a client bring up a sexual fantasy, it doesn't necessarily mean that they want to enact that sexual fantasy. It doesn't even mean that they would actually find that sexually arousing to them. This is also, though, what creates a lot of confusion in people, is like, if I fantasize about that, does that mean I actually want to do that? And it doesn't mean they actually want to do that, right? A fantasy is a fantasy. What a sexual preference is basically, it's a sexual fantasy that's enacted and that's enjoyed. But, for instance, for a client who, and not always, but let's just say a client who has a sexual fantasy about being humiliated, if they enact that and they enjoy it, it might become a sexual preference. It doesn't necessarily mean they want to enact that fantasy of being humiliated. And so I think it's really important as clinicians to make sure that we keep that in mind, because especially when I start getting into some of the more taboo sexual fantasies that people have, as clinicians, we kind of maybe tighten up and like, oh my gosh, does that mean that they're going to go out and want to have sex with an animal? Not necessarily. And I'll talk a little bit about bestiality fantasies as well. Okay, the function of a fantasy. I have two quotes and they seem to be back to back, but the function of a sexual fantasy is to undo the beliefs and feelings interfering with sexual excitement to ensure both our safety and our pleasure. Big quote. Basically what a sexual fantasy does, like I mentioned before, is it creates psychological safety for one to experience sexual arousal. In order to feel sexual arousal, one needs to feel both psychologically and physically safe. Physical safety is a little bit easier for us to grasp. It's like, is it a consensual sexual act? Is there trust? Maybe there's not trust, but is it consensual? Are you choosing and willing to engage in this sexual act? That's a little bit easier for us to conceptualize. In terms of psychological safety, yes, you can say this is my partner, I trust him or her, I've chosen to be in this relationship, and yet you still are escaping to a fantasy. What happens when we are becoming sexually aroused is sexual inhibitions kind of start bubbling up. And sexual inhibitions start at a very young age. It starts when we receive sexual messages from our religion, from our culture, from our family, from our peers, and often they can even be conflicting, right? And so when somebody is engaging in a sexual act, all of these kind of messages, not consciously, you're not like, oh, here they come, but all these messages start bubbling up, and they can create conflict, they can create inhibition. It's not only the values and belief systems and cultural messages that we get received, but also if something's happened. So if somebody's been sexually shamed, I've had clients who've had their bodies shamed or have been in a sexual act and somebody has said something kind of mean about their body or their genitals or something, and they find that they then become embarrassed and develop kind of sexual inhibitions that make them not want to engage in sexual acts. And so by going into a sexual fantasy, what they're able to do is they're able to circumvent all of these feelings and create psychological safety for the body to then become aroused and allow the body to feel, I go like this, but allow the body to kind of take in the pleasure and experience the pleasure. As I mentioned, it's an escape from reality, so it's totally, it's interesting because you can look into this as thinking of somebody like dissociating, right? And I do have clients that have presented and they've been concerned about their fantasies because they are fearful that they're not able to be fully present with their partner because they're escaping into this fantasy. And I think that's where, as a clinician, we need to start, and I'm going to go into assessment, but you go into assessment with a client of like, what is concerning about their sexual fantasy, or what do they want to do with their sexual fantasy? Maybe there's nothing concerning to them about their sexual fantasy. But is really kind of understanding what is the function of the fantasy for them. Is there something in their sexual relationship that they need to escape from? And that's why they're going into this sexual fantasy. But it really is an opportunity to create psychological safety. As I kind of mentioned, it negates all these feelings of shame, self-criticism, rejection, and self-hatred. And it's interesting, these are sometimes like secretive little things. It's like, some people, it's a little bit more apparent. Maybe they've experienced any sexual trauma, sexual shaming. They're dealing with their own stuff and they're very aware of it. But there's also sometimes these like little hidden things of, I don't know if I'm really worthy of experiencing this sexual pleasure. And so they go into a sexual fantasy in which they are kind of experiencing all this praise and admiration and makes them feel worthy. And therefore their body is able to go into a place of experiencing and accepting that sexual pleasure. I want to note here, because I didn't actually note it in the beginning. Okay. I know we're at CHS, so they do a lot of work around sexual addiction here. My presentation is looking primarily at clients that are not struggling with compulsive sexual behaviors. So when you're working with a client who's struggling with compulsive sexual behaviors, while learning and understanding the fantasy is very similar, looking at themes in the fantasy, and when I talk about assessment of the fantasy, it can be very similar. But when I get into the integration of a fantasy into one's life or sharing a fantasy with one's partner, it's going to look different for somebody that's struggling with a compulsive sexual behavior. And the reason why is somebody that's dealing with sexual addiction or compulsive sexual behaviors, often the addiction takes them into a place of isolation. It's not shared, it's secretive. It's secretive with their partners, it's secretive with other parts of their life. And so when you're talking about fantasy, for an addict, you're trying to bring them out of a place of isolation into a place of, let's say if they're with a partner, sharing with their partner, bringing their partner in and opening that up. So I just want to note that, I meant to note that in the beginning, but if you have questions specifically about how it might look different for an addict versus somebody who's not struggling with compulsive sexual behaviors, feel free to ask me, and I'll touch on it a little bit towards the end too. What is normal? Yeah, okay. This is a question that people ask themselves and clients will ask you. Is that normal? What is normal? I don't necessarily like the term normal because what's normal for me is not normal for you, might be different for you, might be different for you. And no matter how much you try and reflect around this question or reflect about their concerns of being normal, they're still going to want to know what is normal and what's not normal. And individuals want to know that because they're fearful. Is this okay that I'm fantasizing about this? Is this not okay that I'm fantasizing about this? When I talk about being a clinician working with fantasies, I say it's helpful to normalize. It's helpful to normalize fantasies. It's helpful to let clients know they're very common. So I am a bit of a hypocrite and I say I don't like the word normal, but I will definitely say to you, let's normalize fantasies. So and that they are normal or typical to have. But I like to go with what is common versus less common. And I think that's important because like our sexuality, there is a range of fantasies. And really what clients are asking, and what people are asking when they're asking, is this normal, is they want to know, do I fit in that range? Does anybody else have these fantasies? Am I the only person over here fantasizing about exposing myself in the middle of an intersection, right? Like, who knows where people go in their fantasies? And so they want to know, do other people have these fantasies? And is this something to be concerned about? And so these are two generalizations, completely generalizations, and I've seen completely the opposite as well. But what we tend to find is men's fantasies are more based on visual stimuli. And this is not even within fantasy work. We see this in sexual arousal work as well and everything. But men tend to be more based on what is the image that I'm seeing? What does it look like? How does it appear? When men talk about fantasies of receiving oral sex, they'll talk to you about both the feeling, but they're also going to talk to you about what does it look like to have somebody be performing oral sex on me. So there's a lot of visual stuff. For women, it tends to be more about emotional connection, feeling within it, their emotional experience in their body. Now, this isn't just romance novel type. When you're talking to women who maybe have fantasies about sexual aggression, they'll still tell you about what it feels like to them, right? So it's not just this romance kind of, oh, I'm all like huggy, but when they're even in a fantasy where aggression is being shown to them, they'll still tell you, I know, like the emotion of it. They'll tell you what it feels like to them, how they feel. So that just tends, but I've also seen the opposite. Don't get me wrong. I've seen men very concerned with kind of the feeling, and I've seen women very kind of focused on just the visual imagery. And as I keep saying, is fantasies can range from being deviant to totally rule follower, from somebody being in pain to experiencing pleasure. It can be from illegal acts to legal acts. Okay, this next slide, you guys, is my most exciting slide, and I'll tell you why. As Douglas mentioned, I have my master's in public health, and I love data. I don't know, it's like this inner nerd inside of me. And when CHS and I had been talking about giving this presentation months and months and months ago, and I had found this journal article, this study that had just been released. It wasn't even in print yet, and literally you should have seen it. I was like, oh my gosh, look at this data. And so I've actually had them printed out and include the table for you guys. And the reason why I got so excited about this is because this question of what is normal. In this study, it was of, let me see, I have it written down because it's data, I think I should be quoting it appropriately. Did you get it? Oh, sorry. Okay, if anyone's missing one, I can get you one. All right, so this study was done in Quebec, Canada. It was just over 1,500 adults. Basically, it was almost even males, females. Unfortunately, only 3.6% identified as homosexual, as gay. Which I would like to have seen a little bit more because we don't have as much research looking at comparison of how people sexually identify. But needless to say, I really much enjoyed this study, and I'm so happy to share it with you guys. So what they did in this study is they analyzed 55 fantasy themes. And they didn't just come up with this. They kind of took it from a previous study, and they took out some themes and added some themes based on kind of being relevant for our times. But they had participants rate the strength of the study. The strength of the fantasy. So 0 was no strength at all, and 7 was like, woo, that's super strong. Like, that really turns me on. That's definitely in my fantasy. So if you're looking at this, it's actually in order of strongest to least strength, and you can see the intensity here. And then there's a column for males and females too. The reason I got so excited about this is look how many themes of fantasies there are. It's fantastic. Ah. Okay, I told you guys I get really excited about it. I'm going to break down just these. So typical fantasies is more than 84.1% endorse them. Feeling romantic emotions during a sexual relationship, oral sex, sex in unusual places, fantasies in which atmosphere and location are important, romantic location, and sex with two women, typically more male. I'm going to go through these and then I'll discuss them more. Unusual for women is less than 15.9%, urinating on a partner, being urinated on, wearing clothes of the opposite gender, forcing someone to have sex, abusing a person who is drunk, and I believe also or under a substance, having sex with a prostitute, having sex with women who have small breasts. Same thing unusual for men in terms of percentage, urinating on partner, being urinated on, having sex with 2 other men, having sex with more than 3 other men. And 2 rare sexual fantasies, less than 2.3%, having sex with a child under 12 and having sex with animals. That leaves, I believe, 49 fantasies in the middle. So that aren't typical, like the most common, but also aren't unusual or rare. That is a huge kind of middle area for clients to fall in and for anybody to fall in. So when people are asking the question of what is normal, there is a huge range on here. And I mean, in the middle, you're looking at having sex with more than 3 people, all women, tying someone up in order to obtain sexual pleasure, being photographed or filmed during a sexual relationship, fantasizing that my partner ejaculates on me. I mean, huge range in this. And I think it really speaks to the fact that fantasies can be so diverse. And so when people are struggling with what is normal, I kind of go to the question of what is more common versus less common. I'm going to touch on, I'm going to go into the 2 rare sexual fantasies because those tend to be a little bit more concerning for people in terms of, oh my gosh, if a client tells me that they want to have, that they fantasize about having sex with a child, what do I do with that? Or when somebody's telling me that they're fantasizing about having sex with an animal, what do I do with that? Both illegal, by the way, right? Going back to the fact that a sexual fantasy does not necessarily mean that the client is enacting that, nor do they want to enact that. But I guarantee you, clients that are having these 2 fantasies are really struggling with a lot of confusion, shame, and fear of judgment. So first of all, for a client to bring these 2 into you is huge. And I think that we need to, with any of our clients that are bringing in sexual fantasies, we need to take it with care. And we need to kind of, if you go to a place of oh my gosh, is it, because it feels risky, right? Are you really wanting to go out and molest a child, or are you just fantasizing about it? It feels very fearful sometimes as a therapist. And so you need to really break it down and assess what is kind of the potential of them acting out on this. And I can go a little bit more into it in assessment, but for instance, are they impulsive? Have they ever acted out on these fantasies before? What do they assess as their own risk of acting out on these fantasies? What is their relationship with these fantasies? Are they concerned about them? Does it have any historical relevance for them? Having sex with a child. When the client is telling you that, how do they see themselves in the fantasy? Are they themselves a child? Or are they an adult having sex with a child, right? Also very different. You can find a client maybe that has incredible sexual shame, is very, very scared of their adult sexuality, and might escape into a fantasy in which they are a child themselves having sex with another child because it makes them feel less threatened by this adult sexual act. But I definitely know that these are the 2, both for clients and for clinicians, that make people a little bit more nervous. But I mean, there's other things in terms of having sex outside is also illegal as well, and tying a stranger up and having sex with them without consent is also illegal. But these are obviously a little bit more heightened arousal in terms of our nervousness. Having sex with animals. What you tend to find is this isn't actually about bestiality, and again, these are generalizations, right? So it's based on every client, but it's not about really wanting to go out and have sex with an animal, but it's something about animalistic in nature. So we find that women tend to be focused more on the size of the penis of the animal, and something about being taken by, and this is both for women that identify as straight and gay actually, that something about being taken by that animalistic feverishness and having something so large kind of take over their body, versus men are more focused and again, generalization, but focused on kind of being able to allow their kind of beastliness or animalness out on something that's less human. Although people will disagree that animals are less than human, but something about not having to care that this is a human being with feelings and with emotions, and so it's being able to kind of ravish without concern about the human nature of this animal. So again, going into meeting our clients where they're at, what is it for them, right? You can just take this, I mean, urinating on a partner or being urinated on is literally like sometimes people have feelings of, you know what, it feels like I'm just being pissed on in life, literally, or being shitted on in life. And so it's not necessarily always about the actual act, but what is the meaning for them or what are the feelings behind it. Definitely read over these fantasies. It gets really exciting. Okay. Sorry, it's just my nerd inside of me. I love it. I'm going to go into talking about bringing sexual fantasies into the office, and I'm not going to ask you guys to share on this, but I want you to think about your own relationship with sexual fantasies. How comfortable are you talking about sexual fantasies? Have you kind of assessed your own relationship with your sexual fantasies? Do you think that sexual fantasies are healthy? In what way do you think they're healthy? What way do you think that they're unhealthy? What are your concerns about sexual fantasies? Do you believe that there's something that should be shared or something that should be kept private? This is totally like just a place that I work from. I always work from a place as a clinician, I'm always trying to grow. And if I'm asking my clients to go somewhere, I always look at myself first and say, what's my relationship with that? What's my comfort level with that? And so I just stop here before we move into kind of the office piece of just thinking about your own relationship with your sexual fantasies and what do you think is healthy or not healthy. All right, bringing in the fantasy. As I mentioned in the beginning, bringing in a sexual fantasy can really assist with resolving other non-sexual problems. And the way that this happens is when somebody brings in a sexual fantasy and you start finding some common themes or some common feelings associated with it, which I'm going to hit on now, it often, like most of this work, it doesn't just stay in the bedroom, right? It's affecting other parts of their life as well. And I think whether you are a person that's in sex therapy or not in sex therapy, you often can see how they go between the living room and the bedroom. Unfortunately, there's not just one explanation for fantasies, and that's because it's really based on clients' experiences. But what I am going to try and do is give you some kind of things to think about and then how you can apply it to your clients. First, just as I did for you, you want to start with kind of assessing your client's values and belief systems around fantasies. What's their relationship with fantasies? Are they concerned about sexual fantasies? Is it something that they grew up and were accepting of sex? Like it was something that they didn't feel like was shameful? Was it okay? Was it not okay? So you want to just start with kind of like I did for you, of your opinions and beliefs and values about sexual fantasies. And then there's two basic ways to kind of bring a sexual fantasy into the office. What I do, and again, because I am kind of in the field of sex therapy, so I can organically bring it up a little bit more versus if you're not working within a sexual dysfunction or something, it might feel a little bit different to bring up a sexual fantasy and intake. But I often do verbal recall. And I don't like always assuming, but sometimes I think assumptions can normalize. So I might ask a client, when you masturbate, what do you sexually fantasize about? What do you fantasize about? Right then and there, I think I'm sending a message that I think it's pretty normal and pretty common. And then I feel like they can come back and say to me, I don't sexually fantasize. Versus if I ask, do you have sexual fantasies? Somebody might be more inclined to kind of say no. So I always try, that's the place where I do kind of make an assumption and I go from the beginning of just assuming. And when you're with your partner or not with your partner, partners, whomever, and you're trying to reach orgasm, what sexual fantasy do you go to then? And they might say, oh, I don't have sexual fantasies when I'm with a partner, or that's when I do have sexual fantasies. And so I always do a verbal recall and I go into it organically. So I talk with the client about it and I ask them what their feelings were in the fantasy, what's happening in the fantasy, what's the imagery in the fantasy. The other way in which you can is written. And actually, okay, just like data, I like books too, and I bring them because I like people to be able to see them. In this book, Living a Life I Love by Weston Edwards, these are also in your references at the end of the slides. This is a workbook for compulsive sexual behaviors, but he has some worksheets in here about sexual fantasy. which I think is great for whether somebody's dealing with a compulsive sexual behavior or not, because it's looking at steps on assessing a sexual fantasy. And what he does is he actually has the client write the narrative, so go home, write the narrative of their sexual fantasy, and then he has them come back in. And he has them read the sexual fantasy one time, no stopping, and then he has them read the sexual fantasy again. And when they're reading the sexual fantasy again, he stops them and he kind of assesses, which then this is what I'm doing in verbal recall as well. He's assessing for any primary thinking errors or any beliefs that might be within the sexual fantasy or feelings associated with the sexual fantasy. I'm going to read some of his open-ended questions because I kind of just want to give you guys an idea. He'll ask very open-ended questions such as, under what circumstances is the fantasy healthy for you? What circumstances is it unhealthy for you? What are your guidelines for disclosing your fantasy? What's your partner's reaction to these guidelines? So that's kind of a pre. And then when he's getting into it, he just says, describe the motivation that is going on. Describe anything from your history reflected in that moment. So looking if there's a historical relevance for you. Describe how you felt, what you thought, how this is important for you today. What would happen if this were to come true? Fears if this was to happen, right? So right there you're assessing for, is this something that they want to enact or is this something that they just want to keep in their head? Because you're also assessing for that too. So you have an idea. Hopes if this was to happen, how would you feel if this was to happen, and what would you think if this was to happen? So you're assessing for what they want to do with the sexual fantasy and the relationship with the sexual fantasy, and then you're assessing for the content of the sexual fantasy. And when we're talking about content of a sexual fantasy, it can get a little bit confusing because our client, we're like, okay, great. We got them to bring in the sexual fantasy. We got them to talk about the sexual fantasy. And now what do I do with it? Because I have no idea what that sexual fantasy really means. And I don't know, like, okay, that's exciting that you told me that. Thank you for sharing that with me. These are some common feelings that you might want to look for. Omnipotence, guilt, worry, difficulty with pride about gender, aggression, insignificance, loneliness, weakness, not deserving of admiration. How do you find these in a fantasy? I'm going to give a few examples. I try to think of it as almost always looking for the opposite. Now, not always, but I'll explain this further, but I kind of look for the opposite. So I'm going to give you an example of somebody who has a masochistic fantasy. So in their fantasy, they are welcoming of receiving pain. They are welcoming of receiving of pain and being hurt. That's their fantasy. In this fantasy, what is sexually arousing to them is the feelings of being weak, the feelings of being helpless, the feeling of having somebody have power over them. When I look at the opposite of that, I think of omnipotence. So how I see this sometimes present is I have clients, I know, it's a little like, I know, I'm going to go in a circle here. What I see sometimes is I have clients who have really high-powered jobs. They are very high up. They have to oversee a lot of people. They have to delegate a lot of tasks. They have to fire people if they need to. They have to hire people. And they sometimes feel a lot of guilt and worry about that. They don't necessarily enjoy that feeling of having so much power and strength. And so what's sexually arousing to them is to escape to a place where, oh, I can release all of that power. I don't have to be powerful. I can actually have somebody create the pain to me, because then I don't have to feel guilty or worry about creating pain to somebody else. I know that they are giving the pain to me. Did that come around a little bit? I'm going to give one more example. Let's go with, okay, there is a fantasy about a master-slave relationship. In a master-slave fantasy, there is the master, who obviously is the master of the slave. Now, for the slave, they, in the fantasy, are they're insignificant in the fantasy, right? They are somebody who, well, let me rewind. In the fantasy, they aren't actually insignificant. They're significant enough to have the master want to pay attention to them, right? So in their fantasy, what's happening is they have this master who is telling them, you are so worthy to me that I need to pay all my attention to you. You are so worthy of my time that I'm going to pay all this attention to you. Somebody in their life that feels insignificant will walk around saying, no one even cares what I do. No one cares if no one notices anything that I do. No one wants to pay attention to me. So they're feeling insignificant in their life. And in their fantasy, they escape into a world in which somebody cares so much about every little move that they're doing and has enough time and believes that there's enough worth in that person to control them. Make a little sense? Am I bringing it around? Okay. Same for the master, actually. The master might actually feel insignificant in their life as well. But they're, in their fantasy, are so worthy and not lonely, right? They have somebody as a partner there that cares enough about them, or is thinks that they are so significant in that fantasy that they're willing to be there with them all the time. And that in their fantasy as a master, they're like, gosh, see how worthy I am that you want to bow down to me and you want to do everything for me. So going back to the function of fantasies is to circumvent all of these feelings that inhibit somebody from feeling sexual. When somebody is feeling insignificant, it's pretty hard to feel sexually aroused sometimes. It's hard to want to share yourself with a partner or somebody that doesn't make you feel good. And so you might escape into a fantasy in which, gosh, look how worthy I am. That makes me feel safe and that makes me feel sexually aroused. I'm going to actually, I'm going to give some case examples as well, so I think that'll solidify it a little bit more. What I do want to say is, because we don't have tons of time to go into each one of them, another book that I recommend is Arousal, The Secret Logic of Sexual Fantasies by Dr. Michael Bader. He breaks down a lot of different themes in sexual fantasies, gives a lot of examples, so if it's definitely something you're interested in, I highly recommend this book. And that's also in your references and recommended reading.
I don't see a reference.
Is it not?
Oh, there it is.
The very last slide.
The very last
Yeah?
slide.
Cool.
There it is. Okay.
It's always good to have recommended readings. Okay, so let's see how we go. Cool. So when you're looking at an individual assessment and when you're talking about an individual coming in, you do a fantasy assessment. It's going to look very different though than if you have a couple coming in, and I'll talk about how it might look different for a couple. But for an individual, you want to do kind of the basic psychoeducation. You want to normalize the fantasy. You want to ask them to recall the fantasies, start looking for some themes, and you want to really identify what are some of the underlying beliefs of the fantasy and the function of the fantasy for that person. This really comes though from historical context. Like I can't necessarily provide. I'm going to provide you an example of a case example. But there's no kind of one cookie cutter way to do this. But really, hopefully, you're doing a comprehensive intake and you're doing a comprehensive collection of historical material that you're able to kind of make some connections. But what you want to keep in your mind is it's not about the actual act of the fantasy, but what's below it. What are the beliefs that are pushing the fantasy, and what's the function of the fantasy for that individual client? What are they circumventing? What are they escaping from? Or what reality are they going in that makes them feel psychologically safer? I'm going to give a case example because I think it just helps solidify all this stuff up here. Obviously, things were changed to maintain confidentiality. Female presented to therapy with me, mid-30s, and she actually presented directly due to concerns about her sexual fantasy. She was married and she was concerned that she's always going into this sexual fantasy and that she's not able to be fully present with her husband. And she wanted to kind of know what was going on. She wanted to be able to be there with her husband, and her sexual fantasy did not include her husband. I'm going to talk a little bit in couples about that, but that's sometimes concerning for people too, is like the fantasy not including their significant other, whomever it might be. She fantasized about a man performing oral sex on her while she was in the middle of like a nightclub. It obviously changed, but there was some things that stayed the same. A man performing oral sex on her while she was pretty much on a stage in the middle of a nightclub or in the middle of a place where many people congregated around her. Predominantly, it would be men in her fantasy that congregated around her, and sometimes some women. And what happened is, in her fantasy, as she was receiving oral sex, she would notice that people were excited about it. People were admiring her body, people were loving it, and people were just totally enthralled by this. And she felt enthralled by this in her fantasy. She reported that this fantasy started early teens, around 10 years old. She started noticing sexual fantasies. And that's when she actually kind of started masturbating. This client too also masturbated regularly as well and used the sexual fantasy in both masturbation and with her partner. She was not as concerned about the fantasy in masturbation, but she was more concerned about the fantasy in relationship when she was having sex with her partner. So when we did, prior to going into the sexual fantasy, I just asked about sexual development. I asked about any sexually shaming, and I don't ask what are some incidents that were sexually shaming, but in my mind I'm going through some things to kind of look for some key points. And she recalled multiple sexual shaming incidences during childhood and adolescence. Some were, for instance, she recalled in her early teens about people talking about stinky fish tacos and referring to vaginas and vulvas, and she became really concerned about her own body odors and the own smell of her genitals. She also recalled when she was really, really young, playing in the yard with a younger brother and some male neighbors. They were all very young, and just kind of pulling their pants down and running up and down. And she recalls her mom pulling her in and telling her, you should never share your private parts with other people. That's not for people to see. And she doesn't recall the males getting shamed. Like she and who knows, right? But she only recalls it happening to her. And so she took the message, like, as a female, this is nothing that should be shared. This is nothing that anybody should see. Very opposite of her fantasy, if you notice. I mean, everybody is seeing it in her fantasy. And so as she grew up, some underlying beliefs is that she then became ashamed of her genitals, and she was embarrassed about being naked, because it expanded from just kind of her genitals to this whole body shaming experience for her. And it was really hard for her to be present sexually then without going into this fantasy, because she felt so much shame. She was so worried about receiving oral sex or there being a smell in her vulva, and that somebody, would be repulsed by her. And so what we looked at, it was that the function of this fantasy really allowed her to negate these feelings of shame and rejection, because here she's being absolutely praised. Here she's feeling that, oh my gosh, all of these people love me. They're enamored by me. They accept my genitals no matter how they smell. They accept my body no matter how it looks. And this was a very safe place for her. It was very sexually arousing for her. And so it allowed her to get over all of these feelings of shame and rejection. So in our work together, what I did, her and I, is that we just we kind of deeply came to an understanding of how this fantasy, this doesn't all happen obviously in the first session. I mean, there was like some work that went around this, and about like, oh, and that's what it's going around, and you're done, thank you. But really we got to this understanding of how it really helps her overcome these feelings of shame and rejection. She didn't present saying, I'm shameful of my vagina and I feel like, ugh, everybody's gonna reject me. But in our work together, we got there. And so when we were able to kind of come to a deeper understanding of why she had this fantasy, the function of this fantasy, it's amazing how when you reduce the shame and judgment and the confusion, it actually just, even that in itself, alleviates people's pressure. I mean, it was amazing to see, because it opened up an understanding for her that she didn't have to fight the fantasy. And when you don't have to fight the fantasy, one, you're able to be more present in your sexual activity, if that was her goal. And two, then you don't have this residual feeling of like, oh, then again, see, I couldn't reach orgasm without going to that fantasy. But she was able to kind of accept it and be like, okay, I noticed what was going on there. And in our course of our work together, she talked about that as she came to a deeper awareness of the sexual fantasy, a deeper understanding of the sexual fantasy, she was able to kind of just like let it come in and out. And she was able to say, she did a lot of self-talk. She was able to say, like, when her fantasy would come, she would, sometimes say, like, okay, maybe I'm feeling some fears of shame right now, or I'm having some fears about my body. Let's sink into it. Let's be in it. That's why I know the fantasy is coming to me. So there's something about, and I feel like this isn't just around fantasy work, but for our clients and for any of our personal work, when you come to a deeper understanding of why we're doing something, why we're behaving some way, why we're having some emotional reaction to something, in itself it alleviates something and it helps heal something, and I feel like it just opens a door for possibility. And so that's really where my work is just starting with helping reduce any anxieties around it and opening that understanding. In couples, I know I'm moving so fast, you guys, but I just want to make sure, and then, okay. So I'm like, and I'm a fast talker anyways, so it works for me. For couples, it looks a little bit different. So you obviously have two people in the room, and they might present with different reasons for wanting to talk about fantasy, or you might see different reasons as a clinician for wanting to talk about fantasy. in talking about sexual fantasy with couples, and again, I'm going to be talking about not couples in recovery from any compulsive sexual behaviors, because it will look a little bit different, and I'll point on that. But for a couple that isn't in recovery from any sexual addiction, again, you want to do an assessment. So you want to assess safety in the relationship, and I'm not talking about physical safety, but psychological safety. Because you want to really assess what's it going to be like if a partner brings up a sexual fantasy that is super bizarre. Is the other partner going to be threatened by that? Are they going to feel disgusted by that? Are they going to be like, ew, I cannot believe that that's where your mind goes? What if one of the sexual fantasies doesn't include the other partner? And what if one partner's sexual fantasy includes their partner? I've seen all of this, right? So you have to really kind of lay the foundation for like why you're bringing in sexual fantasy. You have to, as a clinician, be really kind of attuned with your clients and know, like, is this a time where we can do some sharing about sexual fantasy? Because I tell you, I've seen it. When you get to that place where clients are able to share with each other, it deepens intimacy. I mean, like, if you're at a good place where they're able to like share with each other and communicate, it really can foster a deepening of intimacy, because it's such a vulnerable act to sit in front of your partner and be like, this is what I fantasize about. Because again, it's not sexual preference, it's sexual fantasy. Which reminds me, when you're working with couples as well and you're bringing in sexual fantasy, really laying down the foundation that just because this is a sexual fantasy does not mean you have to enact it. It's not to put pressure on one partner to have to enact this sexual fantasy. This is really a sharing exercise. And then after the fact, we're going to talk about what do we want to do with this sexual fantasy. I've seen couples that are like, there is no way I want to do that. I don't want to engage in that, you know. And I've seen other couples where maybe a partner's like, hey, if that's actually something that you do want to try, like you don't want to keep as a fantasy, I'm kind of open to trying that. But you never know how it's going to go. So you want to prep clients for that, you know, and you want to have that kind of in your mind. And then if they do get to a place of wanting to integrate the fantasy, you definitely can. And like I said on the last slide, I'm going to talk about integrating fantasy, so I'll touch on that. But again, going back to just because a client is sharing a fantasy does not mean it needs to be enacted. I just really kind of want to solidify that, because I know it feels like pressure. You know, it feels like pressure, like, wait, does my partner really want to do this? And so there needs to be discussion around that. And just obviously preparing for potential reactions. But again, I would hope that sexual fantasy doesn't come up unless they might bring it in the room, but maybe as a clinician you wouldn't introduce the activity of bringing up sexual fantasy and sharing sexual fantasy unless you knew that they were at a place of being able to share with each other. I'm going to go back to this really quickly. Sexual addiction. In a couple that is in recovery from any compulsive sexual behaviors, obviously, bringing up fantasy is going to look very different, because when you're working with clients who are struggling with compulsive sexual behaviors, as I said before, sexual addiction is very isolated. It's a very isolated behavior, I guess we can say, and lifestyle. There's not a lot of sharing. So when you're talking about bringing fantasy into a couple that's in recovery, what you're almost trying to do is help the addict move from a place of isolation into a place of sharing with their partner, which is going to deepen intimacy. And so you might do some exercises around helping the recovering addict create a fantasy in which it includes their partner. I don't always require that couples have fantasies with the other person involved, because that's not for me to say what your fantasy should be. But when we're doing sexual addiction work, you're trying to bring the addict from a place of isolation into a place of intimacy and sharing with their partner. So you might do some exercises around creating fantasy for yourself that includes your partner, or that you can share your partner, share with your partner. So it's a bit touchier too when you're in recovery, because obviously sexual addiction is really based in fantasy. When you're looking at porn addiction, all porn is fantasy. And so there's a different process of bringing in fantasy, but it can definitely lead to healthy integrated sexuality post recovery. And I think that that's really important, to not steer away from sexual fantasy when you're doing addiction work. I think people get really afraid of talking about sexual fantasies in addiction work because it feels like so risky. But when we look at how common sexual fantasies are and that everybody's having them, imagine being an addict in recovery and you're trying to fight these sexual fantasies. Like, gosh, that's a risky place for me to go, that's a risky place for me to go, versus helping the client look at how can they healthily integrate that into their life. How can we bring that in? What is unhealthy for you? What is healthy for you in that fantasy? How can we have this be a healthy part of your life? Okay. Case example of a couple. A couple came to me, they were in their early 40s, nearly married, 15 years, had 2 children. They actually presented with sexual dysfunction and difference in desire. The female was high desire partner, male was low desire partner. At a certain time in our work, and it definitely was not in the beginning, and also with couples, I sometimes do an individual intake with each partner, and so I might ask them in the individual intake, what do you fantasize when you masturbate? But when I'm doing a couple intake, I don't immediately be like, so what do you fantasize about and what do you fantasize about? Because that's not a safe space to be bringing that up. So I introduced an exercise of sharing fantasy because I really thought it was going to be at a time in their work that they could deepen intimacy. They were vulnerable enough and trusting of enough to be able to share with each other. And one more book. Actually, these are the clinicians I work with, Doctors Bill and Ginger Prakaw. And this book, From the Living Room to the Bedroom, I use a lot of exercises out of here. It's almost, clients can go through the book themselves, but there's so many exercises in here that clinicians can use to help deepen lasting intimacy. And I use it all the time and pull exercises because it's fun for clients too to do something outside of the office. And they're not all like sexual in terms of about sexual intercourse. They're more about what are some activities that we can do that's going to help enhance our intimacy and expand our intimacy. Because when we're able to expand intimacy for couples, it leads to longer lasting intimacy. When we don't just talk about how are you going to improve your sex life, how are you going to improve your intimacy is more long lasting. In here, there is a exercise about sharing fantasy. And this is actually a written exercise. So it has the clients go home and write a narrative of their sexual fantasy. In here, it says that they want the client to have a sexual fantasy in which the other partner is included. I don't always require that. Like, again, I kind of think, great, if a client brings in a fantasy that doesn't include their partner, awesome. It gives us something to work with, gives us more data, and it gives us more insight into things that are going on. The exercise, they go home, they write the fantasy. They can either share the fantasy together at home. I'm going to grab some water. Are you okay?
I am sorry.
There's water outside too. Okay. Sorry, I don't mean to put just a second. I have water there. So the exercise says that the clients can either share the fantasy at home together or they can come into the office. I usually have the clients come into the office and share it together. I think then we can just kind of look also at how do our clients react and we can help contain anything that might come up and I don't know. I just find it's a good process. So the clients went home, they wrote their fantasies, they came back in. Male reported that it was much harder for him to come up with his sexual fantasy. He was like, I really had to think about it. Remember, he is the low desire partner as well. So he's like, I really had to think about it. But when he came up with his fantasy was really all about his wife. And visually, and when I was putting together this presentation, I thought back to the generalizations of the male and female thing. And I was like, oh, it actually fits. Not on purpose. But his was really about what his wife looked like, simply just naked. And his fantasy included, her in a certain place, and he really just looked at the visual appearance of her naked body, and that was sexually arousing to him. It wasn't really about the emotional connection. For the female partner, she immediately knew what her fantasy was. When I even gave the exercise, she was like smiling, and she was like, oh, I know exactly where I'm going to go. And she kind of laughed about it when she was reading her fantasy, because she was like, it sounds like a trashy romance novel. But her fantasy was really about a man who sometimes was her husband and sometimes wasn't her husband, coming into the room and initiating and kind of just like taking her body, and she felt like so wanted and loved in this fantasy, and she felt desired in this fantasy. And what was so powerful is when I asked her about, how does it feel for you in that fantasy? Like, what's going on for you in that fantasy? She started crying. And that's when she said, it's because I feel desired. I feel wanted. And so this is an example of when the partner's not necessarily in the fantasy, you can find ways to kind of figure some more things out, because what was happening for her in her life is because her partner didn't want to initiate sex, wasn't coming towards her sexually, it made her feel poorly about herself. She felt insignificant. She didn't feel worthy of, his sexual desire. And in this fantasy, this man wanted her. He'd break through the doors. I mean, it was funny because it was kind of like a romance novel. But he'd like break through the doors and take her. And that was so erotic and so arousing to her and obviously made her feel good. And so when we were in this process of sharing the fantasies, and she's sitting there and she's like, yeah, I do feel wanted in my fantasy. I feel desired. We're able to go into that conversation of how the experience is for her when her husband's not coming towards her. And they were able to talk about that. You know, he's able to share, like, for me, I want to show you, for me, I show you other ways that I appreciate you. And these are the ways that I appreciate you. And these are the ways that I want you to recognize how I do think that you're worthy and things. But my point is, it's just to highlight that the sharing between a couple can be incredibly, incredibly powerful. And as a clinician, as you do the work with fantasy work, you can definitely decide, is this a couple that you want them to have a fantasy where both of them are included, or is it not? I think let them go with their fantasy and let's see what comes up and let's work with it from there. Okay, last but not least, we will be on time, yay. Because I know people have parking too, so I'm always conscious of that. Pleasure with fantasy. So again, I've had a lot of people ask me, okay, great, I can help my client talk about the fantasy, I can assess it, we can look at some underlying beliefs, we can look at the function, what if they want to integrate the fantasy? So obviously the same process, obviously you want to do some psychoeducation, you want to normalize the fantasy, you also want to understand what's their relationship with their fantasy, and is there just parts of the fantasy that they want to integrate? What is it about wanting to integrate the fantasy that's arousing to them, right? So, okay. Again, if somebody has a fantasy about being humiliated, let's say, what is it about the humiliation piece that's arousing to them? What parts of those fantasies do they want to bring in? Do they really want to enact an entire fantasy, or is there just pieces of it, such as like being spanked would be good enough for them? So you can help parse it out for them. In Michael Bader's book, he talks about that sex can create shame, but sex can also help overcome shame. And I love that. I really, really love that, because I'm going to go off on a little bit of a tangent here. When people are enacting their fantasy, it sometimes can be incredibly healing for them. Because if you think about, the function of fantasy is to circumvent all of these feelings that really inhibit us sexually. When you're able to enact a fantasy, you're able to master these feelings. You're able to actually make them part of your body, and you're enacting these feelings and these actions that are going to help you kind of voluntarily master any of these intolerable feelings. So I'm going to give an example, and again, it's a little bit of a tangent. But I knew somebody that had been highly traumatized by the church and had some really traumatic experiences. This isn't a client, but she knows I'm going to say this. So she had been highly traumatized by the church, and she had the opportunity to flog in a dungeon. She had the opportunity to flog a man of the church. Incredibly powerful experience for her, because it was consensual, obviously, it was consensual. He was willing to partake, this man of the church was willing to partake in this, they had met, and she was able to kind of, in a sense, master these feelings of, I have power over the church, I am the one in control of this. So she took this kind of, and again, I said this is off a little tangent, but when we're talking about enacting a fantasy can allow somebody to master some feelings, she took something that was going on in her mind, and she had these huge sexual inhibitions from messages that she had read from the church and gotten from the church, and was able, in this process of kind of flogging this man of the church, was able to overcome these feelings and these messages that she got from the church, and be able to say, I have power now, I have control. Okay, I know it's a little bit off on a tangent, but also, if a client wants to enact a fantasy, going back to those unusual fantasies or concerning fantasies, you want to do some assessment. Is this a fantasy that's going to cause them harm? Is it a fantasy that's going to be illegal? Is it a fantasy that they're at risk of causing harm to themselves or causing harm to someone else? Let's say somebody has a rape fantasy and they want to enact a rape fantasy. As a clinician, you can arm yourself with resources to help that client find a legal and a safe way to enact a rape fantasy. There's a huge sect of kind of the BDSM kink community that do act out rape fantasies. And sometimes our clients don't know that these things exist, and so we can, as clinicians, empower our client that if this is a fantasy that you want to enact and see if that, erotically turns you on, let me help you find a way to do that that's safe for you, that's legal, that's not going to get you in trouble. And again, also kind of meeting them and saying what is the part of this fantasy that feels arousing to you that you want to kind of release. If they want to share with their partners, kind of like I was talking with couples stuff, what is some risks? What do they think that their partner might react like? Why do they want to share with their partner? Help them know that this isn't to put pressure on your partner doing, if you're sharing your fantasy so that your partner is going to do it with you, you're not going into it very successfully. Right? So we got to help our clients whoa back and let's figure out what's going on. Does the couple want to begin exploring the fantasy? I think of a couple, the female, she expressed a fantasy and the male was like, no way, I don't want to do that, I have no interest in that. What was great is that we can talk about different ways to integrate fantasy. It does not mean you always need to enact the actual fantasy, but what we got to in exploring, and you got to be creative about this, is if she was able to narrate. So while they were engaged in a sexual act or he was performing sexual, oral sex on her, she would narrate where her fantasy was going. And they were able to share it. It brings him into the fantasy by her verbalizing and saying, this is kind of where my mind is going. This is what I'm doing. And he became very comfortable with it that he then was able to engage in the fantasy of ooh, what would you think if I did X, Y, and Z? So they're not changing anything physically, they're still just kind of in their bedroom performing oral sex on each other or doing whatever they're doing, but she was able to bring her fantasy in and they were actually able to share it, and it was sexually arousing for both of them. So there's ways to help clients expand their sexual fantasy in a coupleship without having to necessarily go down that path if they don't want to. Sometimes couples share a sexual fantasy and one, like I said before, one of the partners says, ooh, I like that. If you want to actually do that, I'm down to try that. And maybe I like it, maybe I don't, and we'll see. But really helping our couples, if they want to play with it, helping guide them play with it, I think is a key. And I'm just going to leave with this other word again, normal. Fantasy is normal/common and healthy. And really it can be fun, sensual, and healing if we can help our clients just understand that we can normalize it for them. We can reduce some shame, judgment, and confusion around that, and really does open opportunity. And I'm done. Okay, I got 5 minutes. I see the door open. I'm on time. Since we do have 5 minutes, if anybody has any questions, you guys have the references and recommended readings. Thank you.
Before we take off, a couple quick announcements.
Thanks, guys. Thanks for sticking with me as we ran through all of it.